While we're moving forward, let me introduce myself. My name is Mark Engel, and I'm here on behalf of the Policy Committee of LAMA and also on behalf of Lutheran Social Services for our, I think it's 5th annual Lutheran Day at the Legislature. And I want to thank all of you for coming and joining us as we join with the most vulnerable in our society to voice our common needs in the public square and activate our faith in love. Take a moment to pat yourselves on the back. We have over 175 people that have registered. It represents 28 of the 30 legislative districts here in Arizona. We have 20 confirmed legislative appointments, so it's going to be a really busy day for everybody. I'd like to give special notation to the 24 people that drove up here from the Tucson area. Yeah. I've been asked to page Reverend Julia Sprinkle, please. This gentleman would love to see you. Thank you. Now, in addition to those folks from Tucson, there's also 15 intrepid travelers from northern Arizona. I'd like to thank especially the teamwork of the people who put this together between LAMA and LSS. First of all, if you were involved in the planning, please raise your hand, helping to put things together. And in particular, I would like to thank Solvi Mus back here. And where's Jay Everly? Jay, where are you? Okay, she's in the back working hard. I got to tell you, a lot of people worked really hard, but Jay and Solvi did a yeoman's job of putting this together and making it happen. So thank you both especially. Also want to thank our district coordinators, people that volunteered to stand up, try and get meetings scheduled, bring people together. Without them, the day does not happen. So thank you all. We do have a professional photographer with us today. You'll know him by the kilt. Please, he'll be taking pictures all day, and note that if they happen, they may be appearing on Facebook or otherwise used for promotional purposes to get more people to show up next year. Woo-hoo! We also encourage crowdsourcing photos. If you can take photos, please do so and make sure that you send them to Solvi at director@lama.org. We can give you more information about that, but those candid photos are great. We've had a little bit of change in plans. The Senate is going to go into session at 11 o'clock this morning. So we will be doing the invocation there at 11. If you would, then there will be an introduction of us for people up in the gallery. So if you'd like to be up in the gallery and be recognized at the Senate, please be there by 11 o'clock this morning. House will still be going into session at 1:30. The same process will happen, but it'll be at 1:30 this time. So if you're in the gallery of the House, we will be introduced. Get to stand up, be recognized. It's a lot of fun. It's pretty cool. But that's the one change, is the Senate is 11 o'clock this morning. So we have to be there for that. Also, because this is crossover week, it's crazy. And some of the plans have to be a little bit fluid today. We thought we were going to be in the Senate Majority Caucus room, and we will eventually be there, but we may not be there until after 11. So when we're done here, we will be able to gather in the Senate Hearing Room 1, which is right across the hall. So please, when we get over there to gather, please gather at Hearing Room 1, and then as the caucus room opens up, we'll be spreading off into that as well. Lunch is to be provided today, hopefully in the caucus room at 11:30. Packets, each district has packets to leave with the people that you will be meeting with. And please stick around afterwards from our guest speakers for a group photo. I'm not sure where I am time-wise, but we're going to go ahead and get started with an invocation from our Bishop, Deborah Hutter, was recently elected to her second term. even more recently just returned from her sabbatical. So she has a ton of energy for us here today. Thank you, Bishop.
Thank you, Mark. I appreciate that. It is good to see all of you. Welcome to our 5th day at the Legislature, and as Mark said, I am Bishop Deborah Hutterer. I get to serve the Grand Canyon Synod, which is all of Arizona, the southern half of Nevada, and St. George, Utah. We gather today not just as Lutherans. I noticed when you went through your list that we do have some UCC folk among us, so could you kind of give a wave? Today we gather not under stained glass, but under an open sky, not in pews, but a place where laws are shaped and budgets are written, and still we are gathered as church. Here we are baptized people, not as partisans, not as pundits, not as political operatives. We are here as people who have been named and claimed by God, washed in grace, and sent into the world. For us, worship and public service belong together. And we pray on Sundays that it inevitably shapes how we live on Monday. The table where we receive Christ's body and blood sends us toward every table where someone is hungry. The font where we are called beloved sends us to every place where someone's dignity is denied. It's the prophet Isaiah who speaks clearly in moments like this. In chapter 58, God addresses people who are doing the religious things. They are fasting and praying and gathering faithfully, and yet God asks this: is not this the fast that I choose, to loose the bonds of injustice, to undo the yoke, and to let the oppressed go free, to share your bread with the hungry, and bring the homeless poor into your house? God is not dismissing worship, God deepens the worship. Isaiah is a reminder for us that faith is never only private, it has a public consequence. God cares about how communities are ordered. God cares whether people are bound or free. God cares whether people have bread. God cares whether people have shelter. God cares whether people have places to live in and survive. Today, our focus is on hunger and homelessness. These are not abstract issues. They are daily realities for our neighbors who have names that we may know or we may not know, but their lives matter to God. When we advocate for policies that address hunger and expand housing, we are not entering someone else's arena. We are standing squarely inside of our own baptismal call. And let's be clear, we don't do this to earn God's favor, because we already have that. We are justified by faith through grace, and we are freed in Christ, and we are freed people who are sent into the world. Amen. Advocacy is simply neighbor love. It is a love that refuses to be sentimental. It's a love that helps shape conversations in courage and in showing up. Isaiah also offers this promise: then your light shall break forth like the dawn. Advocacy is not only critique, it is hope. It's steady conviction that God is at work in places like this, especially here and now. So as we walk into offices today, we bring courage without hostility. We bring clarity without contempt, and humility without silence. We listen deeply, not only for agreement, but for understanding. Speak faithfully, not only your opinions, but your convictions that are shaped by Scripture, by prayer, and by the cross. Seek common good, not victory, the common good. Every person that you will meet today, legislator, staff, member, advocate, even the people who disagree with you deeply, are still child of God. We speak firmly when needed. We are passionate when we're called, but we never forget whose image stands before us. Isaiah also says that we are to be repairers of the breach and restorers of the streets to which we live. That's a beautiful image, that you are repairers. You are restorers. People who mend what has been torn, and people who make communities livable. That's who you are. Trust that God goes before you into every hallway and every conversation. And trust today that your presence matters. Trust that even small acts of faithfulness will help us to participate in God's larger work of justice and mercy. And then finally, trust this, you're not alone. We stand together. Ministry is a team sport. It is a shared calling carried by many voices and bound together in Christ. So may your light break forth here, not for recognition or for applause, but for the sake of neighbors who are hungry, who are without shelter, and for the needs of our shared communities. Let's pray. God of justice and mercy, you call us to worship, not only with our lips, but with our lives. Loosen what binds your people. Free us from fear, from intelligence, and from the temptation to remain silent when love requires courage. As we enter conversations of decision-making, give us wisdom to speak clearly, patience to listen deeply, and humility to seek the common good. Make us repairers of the breach and restorers of our streets to live in, and may our light break forth like dawn, so that people may see you and your glory and your desire for all of us to live together for the sake of your kingdom. We pray all of this in Jesus' name. Amen.
Thank you, Bishop. In case you didn't catch already, when we talked about the changes for when the Senate's going into session, one of the things you learn in coming down for Advocacy Day and working with the legislature when it's in session is that it doesn't matter what you plan, things are going to change, and you're going to change them on the fly. So the first thing is going to do that. The Republican caucus just met in session. Democratic caucus is also in session, but fortunately for us in the Senate, Senator Flavio Bravo is with us here this morning. We'll offer a few remarks. Senator Bravo serves kind of north central Phoenix area. He's been in the House for several years, just recently moved over to the Senate. And Senator? Because he's going to have to run here pretty soon too, I think. So.
Thank you, Mark. Thank you to Connie, to Lisa, to Francisca for the invitation to be here with all of you. My name is Flavio Bravo, and I serve as the State Senator for District 26. It's an immense honor because I was born and raised in District 26. That's where my parents bought their first home. Both my parents, when the redistricting maps came out, I put the map in their stocking for Christmas because I said, you get to vote for me. I don't know if I'll win, but I'll get 2 votes at least, right? Our district starts at Van Buren, which really matters because it's just 2 blocks away from the state capitol. So when you think about the decisions that are made here, the votes that are taken, you really don't have to go far to find the families that are directly impacted. A bit about our district, if somebody just looked at the demographics, over 64 languages are spoken, at the highest concentration of refugees in the state of Arizona, before the next district would be in Pima County. When it comes to SNAP, we have the most amount of children and families who depend on SNAP, and our educational attainment, we're actually ranked first right now, but as far as lowest, below the 9th grade. And what I think is often forgotten in the conversation when we talk about SNAP benefits is that despite all of those obstacles, our families are working. Our families are providing for their kids. They're working as hard as they can to start businesses, many restaurant owners in our district. And so I know that when you come here and you advocate and you meet with legislators to speak about services for seniors, for individuals with disabilities, for immigrant refugee families, personally, I know that you provide a beacon of hope, not just to them, but to us as legislators. It's no secret that we're amongst very partisan times, right? There are issues that one would think we never reach agreement on, but when each of you come here today and you share the stories and the successes of your clients, that gives us hope to say that we have no other choice but to work together. So right now it's crossover week, so we're in the middle of seeing the legislation that just passed each respective chamber as it crosses to the next. And so there should be plenty to discuss with your individual legislators. I want to thank you for your advocacy, for your service, and wish you a great day. Thank you.
Thank you, Senator. Appreciate it very much. And we just lucked out because our next speaker took a few moments out. Not only is the caucus meeting, but he has a bill that's being heard this morning. It's a bill that we favor. And so I'm really happy to introduce to you Senator T.J. Shope. Senator Shope represents the 16th legislative district here, primarily Pima and Pinal counties. And Senator Shope is the President Pro Tem of the Senate. So, Senator Shope, thank you so much for coming and joining us today.
Had to ask what the bill was. I mean, if I'm going to get credit here, I want to make sure I'm talking about it at least, right? No, and part of that, I'm glad it was a laugh line, because that's truly what today feels like in many respects. And for those of you, while I know that there's probably some new folks that are here to the Capitol, there's probably some folks who've been down here a time or two, etc. There you go, right down here in the front row. You see, I usually sit in the back row, especially because you don't want to get called on. But you're fine. That's good. I appreciate you. The world is made up of that. But thank you for being here today. As was mentioned, I'm T.J. Shope, the President Pro Tem of the Arizona Senate, and I hail from Coolidge, which is right in the heart of Pinal County. About 70% of the population of my district resides in Pinal, and about 30% reside in Pima. But very glad to have you all here. I actually had my first instance of visiting the Capitol on an advocacy day. My family was in the grocery business for about 70 years. We owned an IGA supermarket in Coolidge, just sold it a few years ago. But yes, even grocers, especially independent grocers, had a advocacy day at the Capitol, because every group under the sun, come down and talk about what's going on down here and how it affects their life and their livelihood, really. As a part of that, and especially being that young coming down here, you've kind of seen how it works, what it takes to get something done. The bill that was mentioned is a study committee for Medicaid benefits to cover dental issues, and we all know, I served as chair of the health committee here at the Senate for a few years, and know how important it is to capture dental work in that, because of the other health issues that lack of dental care can lead to later in life. And even for some of my friends who really do pinch pennies here at the legislature, a little bit of that care on the front end saves so much money and so much heartache, or toothache in this instance, on the back end for sure. And we have statistics to back that up. So hopefully we'll be able to get that across this year. It is, to me, something that's very important. But as a part of you being here, it's just a reminder for all of us how important you all are to this entire process. It's not lost on me that you are, especially if you reside in those areas that I mentioned or that I come from, you are the person that I answer to, and at the very least give me suggestion on what I should be paying attention to. And that's what you are doing here today, because your advocacy comes in many forms. It can be what you're doing here, being here in person. It could be the emails that are sent, and just a little tip, since I have your undivided attention. Form emails generally are the easiest thing you can do, right? You sign into a thing, you say, hey, I care about XYZ, I want to send an email. They're the easiest to delete, I gotta tell you, because they all say the same exact thing. And yeah, you may get 100 of them in a day, if not more, But by goodness, what means even more are taking the opportunities of what you're doing today. And how many of you have like meetings with members like from your district set up today? Excellent, that's fantastic. Take those, get contact information, say hello to the assistants that are out there bringing you into the meeting and taking you back, and make sure that you take note of what you talked about during the meeting. And then in another week or two, when you send an email saying, hey, I'd like to meet you at home, you know, over a cup of coffee or something in our district, refresh our memory of what we hope was a positive exchange of ideas. And I guarantee you it only takes about 5 sentences. And I know my colleagues, regardless of where they are on the political persuasion, the answer will probably be, sure, why don't we get together and talk, continue that conversation, talk about some of these things. And sooner or later, you're going to be somebody that has a direct line to one of us that are making decisions on behalf of the state, and somebody that, because we all come from different backgrounds of what has led us to be here sitting down in front of me today, that brought you here, you may become somebody's trusted advisor on issue X going forward. And I think that's a positive thing. I have plenty of people in my phone that I can easily reach out to on issues, and it all started with what you're doing today, and it started with a continuation of that at a later date. So very important stuff. You know, when you're sitting there with your legislator today, you know, talk about what those issues are that concern you. How does the issue affect your community? How does it affect your here for Lutheran Day? How does it affect your, not only your church community, but your community at a greater whole? Because churches are, even though they are a community, they are there to serve the greater community, obviously, in that city or town that you're in. The preparedness that you are here, I'm sure that there's a list. I actually was looking at the tables behind me, or in front of me, to see what was on the list. So you're definitely getting, you're definitely fully prepared for what you're about to embark on today, and such. But we enjoy the research. We enjoy learning about where you come from, and then even more so, we enjoy the touring that often happens afterwards. So if you have something special going on in your community that you want to show off, to say, hey, I'd like to, and it's not even about showing off, I want to help raise awareness, because I guarantee you many of the folks that are working behind me have whether it's a social media following or something else, they have a way to elevate the issue that you're working on, the charitable work that you're doing, into something that can reach so many people who are probably not being reached by the work that you're doing. But ultimately, at the end of the day, let's remember, you are the ones who send us here to the legislature. When you explain how an issue affects your everyday life, we tend to have a better understanding of how that works in the real world, right? And the office that we serve in, it's built on a mutual trust and understanding and desire to do the right thing and to help people. Otherwise, we wouldn't be here. So with that, know that my door is open. It may be a little bit difficult today because as the President Pro Tem, I'm the lucky guy that gets to sit in the chair for about 5 hours straight. My hope is that there is a bio break built into that duration, but oftentimes that's why we dehydrate in the morning. But the reality is we got a lot of work to do today. My hope is that the folks that you have scheduled things with will keep those commitments that they've made to you, and just know that in a week like this, crossover week, they can be difficult to do. And if you are able to steal at least just even 5 minutes of time, just know that it is going to make an impact. And it's going to make an impact because of what you're going to do after today, whenever you reach back out to people. So with that, I'm happy to be here. Honored that EL asked me to go ahead and address you today, and I hope you have a wonderful day. We just had our 1 day of winter a couple days ago, and now we're full on to spring. So I hope you enjoy the weather today and have a great one. So thank you very much.
Thank you, Senator Schob. All right. We have a couple more very engaging individuals to offer a few comments. The first one is Mr. Will Humble. Will Humble is a longtime public health enthusiast. He's currently the executive director for the Arizona Public Health Association. He has over 40 years in public health. He must have started before he was a teenager. Include more than 2 decades in the Arizona Department of Health. Will's a believer in using evidence-based health policy to improve health outcomes and in leading and managing emotional intelligence. And Will has a blog. He'd love you to follow him at www.azpha.org. Mr. Humble.
Morning, everybody, and thanks for the invitation today. Again, my name's Will Humble. I've been in public health for 40 years, as you mentioned. My first job in public health was inspecting restaurants, and it was right around here. I had between Van Buren and Washington, or Buckeye, and I did all the restaurants and that kind of stuff. But I really enjoyed that kind of public health work and stuck with it, and it's really been a remarkable and really rewarding career. And the reason it's been so rewarding for me, I think, is that throughout all my efforts, either within the executive branch and now as an advocacy organization, I'm the executive director for the Public Health Association, we're able to actually do things to help people, as the Bishop talked about earlier at the very beginning. Our organization now, the Arizona Public Health Association, it's a nonprofit organization. We're not a faith-based organization, but when I looked at the priority list of the bills that you're focusing on today, that you've signed in as an organization in support of, and the bills that you'll be talking about with legislators today, we are in basically 100% alignment. I mean, the priorities that I saw you all have are the same priorities that we have at the Public Health Association. We're a group of about 1,000. Our membership is about 1,000 people. A lot of them work at county health departments. Some work at state health departments. Some work with our managed care organizations that are contracted through Access, which is the healthcare system for persons, lower income persons and people with disabilities, and academics, and just people who are interested in public health. And our primary mission is really to foster and engage lawmakers and agency directors in evidence-based public health policy, things that help working families, things that you've been talking about all morning. Food assistance, making sure that low-income persons, people with disabilities have a safety net so that they have an opportunity to engage in the community in a safe and healthy way, to help the built environment in a way that makes and fosters and allows people to make healthier choices. So I was really pleased to see that one of your areas of engagement is around food assistance, and it's called the SNAP program, and I know you'll be talking with some of the members down here about that. These are really important conversations to have, because that safety net that's like real life stuff for people and families. And without that kind of assistance, it forces them into making unhealthy choices. They're unable to feed their families. They have to scrimp and save and cut back in other ways that make it more difficult for their family to succeed. So I really fully appreciate, on the behalf of our members, the work that you all are doing, because it does really take a village, and this is a terrific village, an alignment between what your priorities are and what ours are at the Public Health Association. So just a couple of the things that are in complete alignment that you guys are talking about that we've been working on a lot are some of the dental bills. Senator Schob talked about the study committee around oral health coverage for Medicaid members. That's a study committee. It's not going to result in like getting oral health benefits to adults in the Medicaid program, but it does set the stage and starts the dialogue so that in the next year we have evidence and data to better support and engage and build more alignment with the members in the legislature to get that oral health coverage. One of the areas that is, I think, really important, and something that some of you may want to focus on for young families, is a bill. It's a bill from Consuelo Hernandez, who's got a bill so kids who enroll in Medicaid coverage do actually get dental benefits. It's not always easy to find a dentist that'll take the rates that they get, but they do have oral health coverage. But adults really don't. I mean, you could get a tooth pulled up to $1,000 a year, but that's the limit of what you can get through the Medicaid program. And one of the things we really know for a fact, and this is not just one study, but a systematic review of studies that shows that oral health is really important to good birth outcomes. And so for women who have gingivitis, periodontal disease during their pregnancy, they are twice or 3 times as likely to have a low birth weight baby. The babies that end up in the NICU, the NICU departments, it's a relationship with preeclampsia, which is a really bad spike in blood pressure that can jeopardize the life of the baby and the mom. That's a really important bill that you can talk about with members today. Graduate medical education. I was glad to see you guys are jumping in on graduate medical education. This is a long-term intervention. So as you know, many of our healthcare workforce, especially in the rural parts of the state, are in the retirement age. And you've got to build the inventory of caregiving in medical and dental and nursing care, and especially the rural parts of the state. And graduate medical education support is a long-term way of building that pipeline. And you guys are in support of that as well, so I was pleased to see that. But I wanted to spend just a few minutes on, at the very beginning when you invited me to come and give this speech, is that we would like, maybe if you could pick out a bill that you think is maybe perhaps the most important bill this legislative session. And so I thought about it for a few moments, and there's so many good bills, they're on your advocacy list. But the biggest one, I think, is one that doesn't have a bill number yet. It's not even a bill yet. Well, what is it? It is the state budget that ends up being negotiated probably in April, sometime then. And one of the key elements that was in Governor Hobbs's request to the legislature was $17 million for access, that's our state Medicaid agency, so that they would be able and have the workforce in place and get the computer system in place so that when the work requirements and community engagement requirements that came with HR 1, which they have another name for that bill, but I don't use it, which extended big tax credits for high-income people and corporations. HR 1 also had a bunch of new requirements and cuts to the state Medicaid agency. And this is the program that allows low-income people to actually get health care. Well, one of the elements in HR 1 implements what's called a work or community engagement requirement for Medicaid members in a certain income bracket between 100% of poverty and 138. There's about 300,000 people in Arizona that are in this category of people that are now subject to new work requirements. Well, the vast majority of those 300,000 people are meeting the work and community engagement requirements. They are working, or they're volunteering at Goodwill. They're volunteering perhaps at church, or they have a job, or they're in the community college. But one of the reasons Access needs the $17 million in the final budget is because they're going to need to build a computer system that allows people to report that community engagement, volunteering at church, going to school. So unless the state agency Access has the resources to hire the computer people to build the computer program that would allow people to upload this information, they're not going to be able to upload that information even if they are meeting the work requirements. So I know it's a little bit of a wonky thing to talk about, but January 1st is coming really quick, 2027, and I've worked in state government a long time. I know what it takes to make a computer system, get it built, test it with real people on mobile platforms and computers, on Chrome, Edge, Safari, all the other browsers. That's a lot of work. So that's if you ask me what's the most important bill, it's the budget bill that allows Access to build out that computer system and to hire the people that they will need to do the certification. They're going back to 6-month determination for people on Medicaid. So they're going to need 150 people to process all of those applications. So really important bill. It doesn't exist yet, But if you're talking to members today, remind them about how important that funding line is for our state Medicaid agency, because if it doesn't go through, we're going to be facing 300,000, 200,000 people who are going to lose their Medicaid health insurance benefits, even though they really do qualify. So that's a super important thing. And I do like to leave most of my talks with some kind of call to action, and that's this. So for members of the faith-based community, you have lots of people who volunteer time, folding chairs on Sunday or Wednesday, they're serving the hash browns on Sunday for everyone's breakfast, doing the donuts in the cafeteria, in the kitchen, counting the money on Monday morning. All that volunteer work is work that I think is going to be covered under the work requirements that the federal government is going to be imposing starting in January. So my call to action for the faith-based community is to get organized with your leadership so that you have a mechanism so that the congregants and members of the community that volunteer at your churches can document that volunteer time, and so that they can keep their health insurance through access, but they've got to have that documentation from somebody in church leadership to show, yes, they did put in, it's 80 hours, I think, a month. It's 20 hours a week is going to be the work requirement or volunteer requirement. So those are my calls to action. Focus on the budget. That's a really important piece. Y'all are in complete alignment with public health, honestly. When I looked at your list of bills, they're like, is this our list? Our list is about 50 long, and yours is close to that. So anyway, thank you for the invitation today. Thank you for your engagement. Thank you for putting in the time with our lawmakers here. It really is important. And by the way, one last thing, and I know I'm over time, and that's this. Senator Shope was talking about these advocacy days, and one of the things that I'm down here a lot, and one of the things that I think lawmakers kind of get sick of is slick lobbyists, and you'll see them down there, they're dressed better than me. They have Italian shoes that cost $10,000. And they're the ones who are down here every day speaking at the podium. But what lawmakers really like are what they call real people. And that's what you are. You guys are real people. And they like to hear about real people's concerns. So they really do listen. They do, honestly, I think, listen to groups like yours at an individual level more than they do for these lobbyists, because the lobbyists have somebody that's paying them to get something through for a business or whatever. You guys are in it to just, like, you want to help people. And so anyway, it's super powerful. Thank you very much.
Thank you, Mr. Humble. Don't you hate it when a speaker just doesn't believe what he's talking about? All right, our next speaker will be Angie Rogers. Angie serves as the Deputy Director of Programs for the Arizona Department of Economic Security. And in this role, she oversees a number of programs and services across 3 divisions within the agency: benefits and medical eligibility, employment and rehabilitation services, and child and community services. Ms. Rogers has over 25 years of experience in human services operations and has recently moved from being the president and CEO of the Arizona Food Bank, an organization that we've worked closely with. So, Ms. Rogers, thank you so much for joining us today.
Good morning. Solik told me I have an hour to speak. No, I'm teasing you. I really am just here to say thank you for showing up. If any of you have ever started a workout journey, you know that that is 90% of the effort, right? Just getting to the gym. So you're at the gym now, right? And now the last few minutes of work needs to be done. And so I encourage you to make yourself known to legislators. I encourage you to have them remember your face, say something that causes them to remember what you're about and what's important to you. As he mentioned, I have spent 10 years leading the Arizona Food Bank Network, and over the last 3 years have been in this role at DES. The Department of Economic Security has about probably about 7,500 employees right now at a budget of about $7 billion. The majority of that comes from the federal government, and much of that is outlined in the proposals that you are speaking about today. Medicaid, SNAP, those are some of our larger programs that you'll be talking to legislators about. There have been a number of changes made at the federal level through H.R. 1, and the department is rapidly working to implement them. Many of them went into effect the day the bill was signed, which was July 4th. Others are kind of in a staggered implementation process, and the department is responsible for most of that. So as you can imagine, it's very busy right now. We continue to get guidance from our federal partners every day, and a couple of them that I know you're familiar with stand out for me. One is a cost-sharing provision that H.R. 1 implemented that shifts SNAP benefits from the feds to the states. So in a previous life, I guess, those benefits are paid 100% by the federal government. If you receive a SNAP card, those dollars on that card were 100% federal. That shifts it to 75-25. What that means is about a $40 million hit to our state general fund. That's going to need to be funded in this budget, as Will mentioned. The second piece is an increased focus on what's called the payment error rate. And I think this often gets confused by a lot of really smart policymakers, and it's frustrating because it's a very technical calculation that we work very closely with the feds on. Ultimately, there's a sample of cases, about 1,100 of the nearly 400,000 individuals that we serve, that we sample to determine whether or not we determine benefits accurately for those households. If we overpaid them, it's an error. If we underpaid them, it's an error. If we made an error because we fat-fingered something, that's an error. If we overpaid them because they forgot to tell us about employment, that's an error. This error last year equaled about $37,000. If we don't get this under 6% of our total allocation, we are going to be penalized between $100 and $300 million. So we are landing a plane on a pin, and we're doing the best that we can, but we are working as quickly as we can to implement these, but these are the stakes. And so that's why I just started with thank you. Thank you for being here. Thank you for speaking up for your neighbors who can't be here because they are busy working, trying to put food on the table for their families as well. And then I have one request as I close out my remarks, is to make sure that next year when you come to this event, you bring a friend, you bring a neighbor, because we all know that you know someone who is equally passionate about this work, who cares as much as you do about what you are speaking to legislators about. So bring someone next year that can sit with you, that can go over and talk with you, that you can introduce to your new friends, the legislature. Thank you.
Thank you. Before I introduce our last speaker, very quickly, it occurred to me, you may wonder why we have the people coming that are coming. And there is actually a method to our madness. The Llama Policy Council, for the year, established 4 policy priorities. One was hunger, one was health, one healthcare, one was housing, and one was civic engagement. And so if you think back to the speakers that we've heard, it may become very obvious why they were chosen. Which leads us to our last speaker. Connie Phillips is the CEO of Lutheran Social Services of the Southwest. And I have to tell you that I probably wouldn't be here, and I'm not sure this event would be here, but for a large involvement of Connie back when we started Llama and advocacy here. And so, you know, I think, I just have to say, by way of introduction, one of the most dynamic and one of the most interesting people that I've met out here, Connie Phillips.
Wow, here we are again, right? 5 years later. Thank you. How many people have been here for all 5? Woohoo! Thank you, thank you, thank you. And I love Angie asking us to bring a friend next year. Well, I am Connie Phillips. I'm the
President CEO at Lutheran Social Services of the Southwest. Been there about 11 years. Our mission, for those of you, I can't imagine there's anybody here who doesn't know this, is to stabilize people who are in crisis, build a foundation for people to thrive, and to preserve dignity and respect for our vulnerable neighbors. And for those of you not familiar or trying to keep up with what we're able to do, we are still in 4 counties. We're in Pima County, Santa Cruz, Cochise County, and Maricopa County. We still serve refugees and immigrants in Tucson and the Phoenix area. We are working with older adults and people with disabilities in southern Arizona. And we work with children and families and have the 2 food pantries in partnership with our congregations, 2 congregations in the East Valley. Our work is being impacted, very much impacted by the transitions that are occurring at the federal level. But I will tell you that we are doing our best to stabilize ourselves and to continue with your partnership. And some of you have heard me talk about this many times or seen our information, Partners in Action. That is what you are today, is a partner in action. We need you in order to continue to be able to execute on our mission. We are going to be leaning more and more into our volunteer network, our advocacy network, our congregational network, because we can no longer depend on our federal partner to provide us with the kind of support they have over the last, I don't know, I've been doing this work for 40 years, so, since I started. It's all kind of changing. Services are really important. It's so important that we're able to be there. And last year we served about 20,000 people here in Arizona. And people call us all the time looking for help. They are asking for help. And we have to be able to respond. And one of the ways that we can help is by speaking out on behalf of the neighbors who are calling us, who are in need. Because these long-standing programs, as I said, with the federal government, they're just changing. And you may think that's a good thing, less government. You may think that's a bad thing. That's just the reality. It's changing. And so we're having to change with it. Federal decisions are being made. That's not what they're deciding here. And I want to make sure that you're making that distinction, because those are having a huge impact. But what the implication is, and as you heard Angie speaking about, the state has to come up with more money now. Well, that's a state decision. You heard Will talk about the budget. The budget is such an important aspect because that's a state decision. And they need to hear what's important to the people that you have interaction with and what needs to be prioritized in that budget. Just an example, refugees who were welcomed into our country a little more than a year ago, they're no longer eligible at all for SNAP as of Sunday, March 1st. That's when it cuts off. They cannot get SNAP. It doesn't matter if they're working. It doesn't matter if they're under a certain income. They are not going to be able to receive SNAP benefits any longer unless they have a green card. Well, if you've only been here a year, you're just now in the process of applying, and there are many countries right now that you can't get one if you're from those countries. So we have a certain number of people that we are saying, you can't have SNAP. Well, where are those people going to get their food? Because they're working full time, but once they pay their rent, they've got $100 left, $150 left, and they're supporting families. So we have to step up for that as congregations and volunteers, and we have to tell our legislature, look, this is a finite number of people. It wouldn't cost that much to allow them to have food, and that's a basic need. So that's one of the reasons why we're here. People with older adults and people with disabilities that we care for in their homes, they're telling us already that they're seeing reductions in their SNAP benefits. And some of their hours are being cut back that they receive care. We do not have money for emergency services like we have in the past. Contracts and government grants just aren't available for that. And while requiring able-bodied people who receive assistance with food to work may sound like a really good idea on the surface, I read some studies about who those people are that are not working, that are in that sort of able-bodied age. And you know that there are actually a lot of women in that category that are caring for family members, either older adults, their mother-in-law, their mothers, their fathers, they're caring for somebody, or they're informal caregivers for children. So they're not getting, that documentation Will was talking about, they're not getting anything that they can document, but if you take them out of the equation, who cares for their older adult? Who cares for their family member? Policy makers need to hear these stories because government must set policies that support people to live to their fullest, not deny them access to food and health care. Now, many of you are very involved in your food ministries. You know the stories of the people who come every month to receive their food baskets. You know the struggles of the people that are calling your church office to ask if you can help them just for a little bit, or asking for rent assistance. You're seeing the struggle of the people who come to you or in your own congregations. Those are the stories, as you heard Senator Shope talk about, that we need to be telling to the senators and the people in the House. They don't know if no one has told them. You have to carry it. That's our responsibility. Tell them what you know. I know a lot of people get nervous about, what will I say to the legislator? I don't understand these bills. I can't really talk about these bills. You know what? You don't have to. You know what you need to talk about? Is I have a neighbor who really needs help and they can't get it. Or Deacon Wendy here has been working with St. John's, and she and I talked about, because she's also working at LSS, every week when you get done answering all those phone calls of people who are calling for rent assistance, write a letter to our representatives and tell them about the people that you talk to and why they're asking for help. Because we need to blow that story that they're not worthy somehow and explain that they're working hard and that they're trying to overcome barriers. So thank you for being here. But as I tell you every single year, do not let this be the only time you are at the legislature. Do not let this be the only time you talk to your legislator, your policymaker. You need to follow up. Now they know who you are. And even if they didn't see you, you can write them a letter that says, you know what, I was there. I would have loved to have met with you, but I couldn't get in to see you. Here's what I am concerned about. Here's the story I want to share with you. Okay, so I saw Nicole walk up a little bit ago, and I'm going to warn you, Nicole, I'm going to quote you if you're still here. I've changed a little bit of this, but I just was so overwhelmed by this part of her blog that I received. Nicole is the president CEO of Arizona Housing Coalition. And she, we've been grappling with the Housing Coalition about a lot of bills. What do we take a stand on? What do we not? And how do we figure that out? And so this is something that she wrote after she was writing about the bills, and I just want to share it with you because I thought it was so profound. She said, legislative outcomes are shaped by repetition, presence, and clarity. They're also shaped by something deeper, understanding what policymakers actually value, what they fear, and what they believe that constituents are asking of them. When policy seems wrong, it's rarely because there wasn't enough evidence. It's because what drove those decisions hasn't been adequately addressed. Influence requires listening as much as speaking, acknowledging that conviction is born of motive, not just information. Lawmakers hear hundreds of voices every session. The ones that break through, they're specific, they're local, they understand the terrain, and they show up more than once. The written comments, the sign-ins for the right to speak on the online system, the testimonies that are in a hearing, the follow-up emails, the requests for meetings, these build a record. These shape decisions. Thank you, Nicole, for those words, because that's what this is all about. This is about showing up over and over and over again and saying, I care, the people I interact with care, we care, we're asking you to do what is just, to do what is right. Thank you for being here.